Welcome to today's webinar brought to you by OraSure Technologies Incorporated. OraSure Technologies is a global leader in oral fluid substance abuse testing products. Their unique assays provide accurate and easy-to-administer testing methods to help determine the presence or absence of drugs of alcohol in a person's system. Oral fluid-based testing products provide a simplified collection process, faster results, cost savings with minimal risk of tampering, and dramatically reduced risk of adulteration. The Intercept Oral Fluid Drug Test is an FDA-cleared laboratory-based oral fluid drug testing system that enables accurate testing for drugs of abuse, including marijuana, cocaine, PCP, amphetamines, and opiates. With a fast and easy-to-administer collection process, Intercept is ideal for workplace, criminal justice, drug treatment centers, and clinical setting screening programs, among others. Today's presentation is entitled Student Drug Testing Works When Done Right, and will be presented by Bill Current and Kay McPherson. Bill Current is the president and founder of WFC & Associates, a national consulting firm that specializes in drug testing policy development and providing accurate and up-to-date state drug testing law information. He is the editor of the online Ultimate Guide to State Drug Testing Laws at statedrugtestinglaws.com and the publisher of the e-newsletter State Drug Testing Laws Monthly and the weekly e-news service Drug Testing in the News. Kay McPherson founded Quality Control Testing on May 15, 2005 as a woman-owned small business drug testing company. The business has grown over time to include such things as physicals, DNA testing, and so much more. Quality Control Testing is also a Texas DOT-approved company. Kay has worked for 25 years in the occupational health service field. She is a certified professional collector trainer and breath alcohol technician instructor, corporate trainer for quality control testing, and is a regional certified professional instructor for drug testing through DAISHA. It will now be our pleasure to hear from Bill Current and Kay McPherson.
Well, thank you very much, Jessica, and thank you to everyone who's on today's webinar. First, I want to express appreciation to OraSure Technologies for hosting these monthly webinars that are hopefully educational and valuable to you. And also I wanted to say how excited I am to be co-presenting today with Kay McPherson. Kay and I have had the opportunity to talk a number of times about the student drug testing services that she offers through her company, and I'm really looking forward to her part of this presentation. As some of you probably know, we do a lot of webinars here at our company. Last year we did over 40 webinars, and we're on pace to do even more than that. And lots of times I'm the presenter. And so if you've never been on a webinar with me as the presenter, what I'm about to say probably will be neither here nor there to you. But if you've heard me speak before, you'll probably find this hard to believe. But I'm going to try to keep my part of the presentation to a little bit less time than I normally speak. So that's the hard part to believe, because I'm really looking forward to hearing what Kay has to say. In fact, we talked yesterday and again this morning, and some of her insights on student drug testing are really fascinating, and I think that you're going to find that her part of the presentation today very valuable. Here's the overview of what we're going to talk about. I'm going to start out with a little bit of information about oral fluid testing, to make sure I forget to get to it, and then we're going to talk specifically about the reasons for considering a student drug testing program, the easy steps to setting up a program. It's really not that challenging, although you have to do it right, and so we're going to talk about those easy but essential steps to setting up a drug testing program. We're going to talk a little bit more about oral fluid testing specifically as a testing medium for student drug testing, and then what I like to call student drug testing in the real world, which will be Kay's part, where she talks about her actual real-world examples and experiences of working with student drug testing programs. So first, just a few words about oral fluid testing to start out with. And I always refer to oral fluid testing as an alternative, and I know sometimes people are perhaps not sure what I mean by alternative. It's an alternative to a traditional urine lab-based drug testing program. Still, even to this day, especially in the workplace drug testing market, the most common type of drug test is a lab-based urine test, where you collect a urine specimen, usually at an off-site collection facility. The sample is then packaged and overnighted to a laboratory. It goes through an initial screening process, and if that's a non-negative, meaning there's some presence of a drug that you're testing for in that screen, then it will be confirmed, usually with what's called gas chromatography mass spectrometry. And if that confirmation test is also positive, then it'll usually be verified by a medical review officer. And an MRO, medical review officer, will attempt to get a hold of the donor to find out if there's a legitimate medical explanation for the positive result. And then based on his or her assessment of that process, the test result would be reported either as a verified confirmed positive, or the MRO might report it as a negative if he or she accepts the explanation that's provided. So oral fluid testing is an alternative to that process that may include some of those steps, especially lab-based oral fluid testing, but there would be some flexibility to it because of the simpleness, the ease of the collection process. An oral fluid sample can be collected virtually any time and anywhere. The science is legal, the technology is legally defensible. It's scientifically accurate. It's a probably more precise measurement of recent use because of the window of detection, which I'll talk about a little bit later. And as I said, it's easy to administer. Now, in a school environment, oral fluid testing probably adds a fairly high level of dignity to the testing process because the gender collector issues are eliminated, because there are no bathrooms involved. You're not asking anybody to provide a urine sample. You're not trying to secure restrooms, to turn off the hot water, to put bluing dye in the toilets, or any of those things. All of those issues go away. In fact, with an oral fluid collection, you can observe the entire collection process from start to finish on every test, regardless of whether the person administering the test is male and female and the donor is male and female. There are no gender collector issues at all. The collection process eliminates all the embarrassment that's usually associated with a urine collection. The shy bladder issues go away, the yuck factor issue goes away, and best of all, for a lot of people who are really concerned about the level of drug test cheating that typically goes on with urine testing, oral fluid testing is virtually adulteration proof. It's very, very challenging to cheat on an oral fluid test, and I'll explain a little bit more about that a little later in today's presentation. Now, it actually was about 10 years ago. I didn't realize it had been that long ago, but about 10 years ago, I wrote a booklet called 9 Reasons to Say Yes to Student Drug Testing. And these are the 9 reasons. And the booklet contained, information and statistics and reports, and everything was sort of backed up with the sources and everything on each of these 9 reasons to consider student drug testing. In today's webinar, we're not going to have time to go through all 9 of these. I think, that would probably be a fascinating discussion in some respects, but I'm going to focus primarily on the ones here in bold. The fact that too many kids use drugs, drug use impairs learning, drug testing saves money, and drug testing works. And so I'll get into each one of these, but they're part of an overall sort of, they're just pieces in a mosaic in terms of the considerations that a school or a school district would give to making the decision to implement a student drug testing program. So the first one, too many kids use drugs. There are 2 major studies that come out, surveys actually, that come out every year that measure the magnitude of the drug problem among young people. The first one is the National Survey on Drug Use and Health. And if you've been on one of my webinars in the past, I typically refer to the National Survey on Drug Use and Health because it's been coming out since the mid-'70s. It used to be called the National Household Survey on Drug Abuse. And the statistics really give us a good idea of drug abuse overall by drug, by age categories, by gender, by employment, by regions of the country, etc. Okay, so this first slide refers to some of the statistics that came out of that. And let me just point out, so the big picture is that there are about 24 million Americans over the age of 12 and older, who admit to being current users of illicit drugs, meaning they used an illicit drug at least once in the 30 days prior to participating in the survey. That's just over 9% of the population here in the United States, 12 and older. Among 12 to 17-year-olds, among youth, you see that the rate of illicit drug use dropped between 2002 and 2008 from 11.6 to 9.3. Then it went up again in 2009, kind of stayed steady 2010, 2011. It dropped again between 2011 and 2012, between 2009 2012, to about the same rate that it used to be in 2009, I should say. What's interesting here, though, is that we're not really sort of making much progress. It looks like it's going up and then it comes down. In fact, the government refers to that 9.5 as sort of a statistically insignificant drop in the level of drug abuse. The total number of young people using drugs pretty much unchanged. Now, I said there were two major studies for youth drug abuse. The second one, and probably the one that gets referred to the most when it comes to measuring drug abuse among young people, is Monitoring the Future. This comes out of the University of Michigan. It has been in play for many, many years, and it only measures drug abuse among young people 12 to 18. The 5-year trend here with the Monitoring the Future report is showing a significant increase in past year and past month marijuana use. Remember, a current drug user is somebody who admits to using an illicit drug at least once in the last 30 days. But the report also shows people who admit to using an illicit drug at least once in the last 12 months. And so in those two categories, past year and past month use of marijuana, we're seeing increases in all three of the grade levels that they monitor as part of this particular survey: 8th graders, 10th graders, and 12th graders. So the second bullet shows that between 2008 and 2013, in about a 5-6 year period there, past month, in the last 30 days, past month use increased from 5.8 to 7% among 8th graders. This is really astounding when you think about the age of an 8th grader. 13.8 to 18% among 10th graders, and 19.4 to 22.7% among 12th graders. It's astounding when you think about it. And a lot of it correlates directly with the fact that the perception of harm and disapproval associated with using marijuana is decreasing. And so as the perception of harm decreases, the rates of usage of the drug increase. And I have given a number of presentations on marijuana to workplace audiences, to audiences of employers, and one of the things I tell them is the reason why you need to be concerned about drug abuse among young people, if you're an employer, is the fact that these are the people who are just now, especially 12th graders, starting to knock on your door looking for their first job. And so you need to be aware of, and to a certain extent concerned about, the rates of drug abuse among young people. In fact, some years ago, about 15 years ago, probably more than that now, I wrote a book called Today's Teen Drug User, Tomorrow's Job Applicant, where I put all of these figures into one source into this book, and then talked about how important it is for employers to get involved and to know what's going on in their communities, especially when it comes to drug use among young people, okay? In addition to marijuana abuse, there's also been an increased abuse of prescription stimulants, and that should be a cause of concern as well, because that's a level of drug abuse that people bring into the workplace when they get old enough, okay? It's also a problem, obviously, if you're in your school administrator. This is something to look at. And there's a lot there. I'm not going to go through all of these. I think that second bullet is pretty interesting in terms of the perception of harm in using Vicodin and the rate of Vicodin abuse at the different age levels. This chart, now I'm going back to the National Survey on Drug Use and Health. This bar graph here actually shows the levels of drug abuse at different age categories by drug. And so you see in that first grouping of vertical bars there, the blue one is the use of psychotherapeutic drugs, so that's stimulants and sedatives and tranquilizers, things of that nature, quote-unquote prescription drugs. And you can see among 12 and 13-year-olds, that's the drug of choice. For the youngest of our people, in those teen, semi-preteen years, using prescription drugs that they get from their parents, they get from their friends, maybe, through other means, that's the number one drug of abuse among young people. And then the next one, the gray bar, is marijuana. So you can see even marijuana doesn't compare to the rate of psychotherapeutic drug use by young people. Now, that next grouping of bars, you can see that it changes. Ages 14 to 15, you're going to see a significant increase in marijuana use by this group of young Americans. Prescription drug abuse, the psychotherapeutic bar, that blue one, it went up too. but it couldn't keep pace with marijuana, as you note there. Inhalants actually comes down among older kids. And if you go to the last grouping, you see that, of course, marijuana is practically off the chart. Psychotherapeutics have gone up. They continue to go up from age group to age group. But, of course, by the time kids are 16, 17, and as we saw in one of the previous slides, 18, the rate of marijuana use has really, taken off, and it becomes by far the most commonly abused drug among teenagers. But psychotherapeutics are up there as well. That's important to keep track of. For many, many years, as the federal government, put out these reports, it was always marijuana number one, and for a long time, cocaine number two. And as you can see among young people, cocaine usage has diminished significantly. It picks up a little bit between ages 16 and 17, as you can see there, 0.2%, but it's really marijuana and prescription drugs where the vast majority of drug abuse among young people takes place. Let's get into some of the reasons. Now, we know what the level of the problem is. We know too many young kids are using drugs. Let's talk about how it affects certain things, like learning, for example. There was a survey that came out some years ago from Columbia University that indicated that 60% of teachers felt that drug use had diminished the quality of education in our nation's schools. Now, when I first read that, I wondered if it was drug use among teachers. Probably not as well worded as it should have been when it came out in the report. But, of course, what they were referring to was the negative effect that drug abuse among students has in the school environment. There was a National Drug and Alcohol Center report that linked marijuana use and poor school performance. That was fairly significant. A report out of New Zealand that got very specific showed that chronic marijuana smokers have trouble remembering things. They forget their books at home. They even fall asleep in class. And so if you're not paying attention in class because you can't stay awake, if you can't study because you didn't bring your books with you from home, or you're simply forgetting the fact that you have an assignment, that you have a test because you're a chronic marijuana user, then I think it's safe to conclude that marijuana use impairs learning. And there's a lot of movement in our country right now towards the legalization of marijuana. And it ignores the negative impact that marijuana use has on people who smoke the drug on a regular basis, who use marijuana regularly. And that's not just in the school environment, it's in the workplace and on the roads. In fact, I did a webinar just a couple of weeks ago on marijuana, and it was interesting. I found a study that showed that traffic-related fatalities have tripled in the last, fatalities linked to marijuana, I should say, have tripled in the last 10 years. Incidentally, or perhaps coincidentally, if you're in favor of drug abuse, you might sort of shrug this off, but that 10-year period sort of coincides with the increased rate of states legalizing marijuana for medicinal purposes. So there's definitely a link there. I think that drug testing saves money, and I base that on a number of things. I've been in the drug testing business for nearly a quarter of a century now. That's not the best way to put it. For the last 25 years. And it's definitely proven to be a money saver when you look at the return on investment in drug testing, say, in a workplace environment. But this, according to a study that came out from Columbia University, the National Center on Addiction and Substance Abuse, drug misuse and addiction, that should say, that's a typo there, adds 10% to the cost of elementary and secondary education each year. So in an economic environment, the kind that we live in right now, where education budgets are being cut, where extracurricular activities are being cut because there isn't the money for it, to be able to pinpoint the fact that drug abuse and addiction are adding costs to elementary and secondary education should be a giant red flag to politicians and lawmakers, to school administrators, that we have to address this issue, that an investment in this issue, in education and drug testing, are a way to cut the cost of this problem in our schools. Schools spend about $41 billion in costs related to class disruption and violence, tutoring, truancy, teacher turnover, which is a big issue. Obviously, if you're on today's webinar and you're in the in the school profession, the education profession, you know that teacher turnover is a big issue, and sometimes it has to do with the environment of the schools or the school district where they work, and the fact that a lot of that negativity is actually being perpetuated by the environment of drug abuse that exists in a lot of our schools and school districts. That's just sort of exacerbated by the student drug use problem. So in terms of saving money, there's lots of different ways to look at the return on investment. I think in the most broadest sense, drug testing works. It works as a way to deter drug abuse in the workplace, in treatment programs, in the criminal justice systems, and very much so in schools. There have been a number of studies that have come out trying to measure what effect it has on a drug user to know that drug testing takes place either where they work or where they go to school, etc. And I thought this was interesting, a study that came out from the federal government. It was a survey of people who self-identified as illicit drug users. It found that 30% would not work for a company that conducted pre-employment testing, and 40% would not work for a company that conducted random drug testing. So again, I know that's not the school environment, but I think the message is the same. The drug users don't like drug testing. They particularly don't like random drug testing. In fact, back in the 1980s, when the Navy discovered that it had a significant problem with drug abuse, this happened in the early 1980s, they initiated really the first large-scale random drug testing program. And 83% of Navy enlisted personnel said that drug testing was, in their opinion, the #1 deterrent to drug use, and 27% actually admitted that they would go back to using drugs if the Navy were to discontinue its drug testing program. So from a deterrent effect, it definitely has a major impact on the level of drug use. And I would also say that it is one of the most effective ways of identifying people who need help. Now, when it comes to implementing a drug testing program in a school environment, I've put up a few points here. Kay actually has some very detailed information on that I think she's planning to share a little bit of today, as well as sort of talking about the common mistakes that schools make in putting a program together. But just to sort of capsulize it in these 6 easy steps, the first, of course, is to identify the magnitude of the drug problem in your school environment. Well, we all know that there's a problem with drugs among young people, among students. But as you go into the community to gain the support of parents, teachers, administrators, even the students themselves, it helps to know what the level of drug abuse is in your particular school environment. This will make it real. It will bring it home to the parents, to the other administrators and teachers who are involved in it, who are going to be involved in helping you put your program together. You're going to create a task force of people from various parts of the community. As I say here, parents, teachers, students, and administrators, maybe others, maybe business leaders from the community as well. And it will help to have that kind of information on hand as you begin to talk and formulate ideas as a task force. And one of the great ways to get that information is not just from the statistics that I've used here today, which are national, but it's to talk to law enforcement in your community. Talk to the students who go to your school and ask them, what is the magnitude of the drug problem here in this school, in this district, in this community? And they'll be able to tell you, especially law enforcement, they'll be able to tell you the drugs that kids are using, how much drugs they're using, what the trend is. You know, you hear a lot about synthetic marijuana nowadays, like K2 and Spice. They'll be able to tell you what the trend is in synthetic drug abuse, in marijuana drug abuse, in prescription drug abuse, because they deal with it every day. And then as a task force, with that information in hand and everybody's on the same page, then you begin to identify your drug testing objectives. What is it that you hope to achieve by conducting drug testing? You develop a policy. Policy is the cornerstone of any drug-free school program, especially if it's going to include drug testing. The policy has to be in place that states essentially what your objectives are, what the prohibited behavior is, what the consequences will be for violating the policy, and then very importantly, how drug testing will work in your school or in your school district. Here today, of course, we're talking about oral fluid testing. So how will oral fluid testing be conducted? Who will actually administer the tests? How will the samples get to the laboratory to be analyzed? How will results be reported? And then, of course, with positives, how will consequences be meted out? And that's where choosing the method that's right for you comes into play, because as your task force looks at the issue, they realize the magnitude of the problem, you start to formulate your policy, then you want to pick a drug testing method that will help you achieve those objectives. And the parents have to be part of the process. They have to be part of the task force, and they have to be part of how you roll the program out, how you inform individuals of the program that you're going to have in your school. A little simplified. Kay's going to get into more of the details. In just a few minutes, let me just say that when it comes to any drug testing method, but a new drug testing method, it's new to you, new to your environment, I think you want to ask three questions. Is it accurate? Is it legal? And is it practical? In other words, will it work for us in our unique circumstances and with the environment in which we're at? And there's a lot of information here over the next few slides. I'm not going to spend a lot of time on it, but studies have found that the positivity rates with oral fluid testing compared to traditional lab-based urine testing, very, very similar. The window of detection is sort of an advantage with lab-based oral fluid testing because it detects drug use almost immediately after somebody has used drugs. So if you have students who are perhaps using drugs during a lunch break, when they come back to school and they're exhibiting the signs of being under the influence, an oral fluid test is going to detect that drug use within minutes after the drug use actually has taken place. Whereas with a urine sample, you're going to have a lag time of about 60 minutes, thereabouts. And with hair, of course, that's a lag time of days. It's a different testing method with a different purpose altogether. But I think you want to look at the empirical data that exists for whatever product or method you're looking at using. Make sure it's empirical, independent data, not just sort of based on the marketing material of the manufacturer of the product. Look for FDA cleared products. That's always the safest bet, whether it's the collection device itself or the testing process in the laboratory for the particular drugs that you're going to test for. Make sure they're FDA cleared. Obviously, ask for referrals. Conduct your own research. Ask for some product that you can experiment with, that you can do a little pilot program with, and put the package insert. All of these products come with a package insert, that little piece of paper that's in the package with the tiny, tiny writing on it that tells what this product is supposed to do, how it's supposed to be used, what kind of results you can expect from it, etc. Read it and put that package insert to the test so that you know what you're dealing with and who you're dealing with when it comes to any drug testing method, regardless of what it is. Now, I'm going to take you right to this chart on this page because it shows the window of detection as I just described. Oral fluid and blood, you see the blue and the red lines there. They both are very similar in that drug abuse can be detected immediately after ingestion of a drug. You can see the yellow line, which is the urine, is a little farther over to the right because it takes about an hour or so before drugs will show up in a urine sample. And then, as I mentioned, hair is going to be about a week out. It's going to have a much longer window of detection, right? It goes out to about 90 days, but it doesn't start immediately. Okay, and that's the big difference in terms of window of detection. So if you're concerned about recent usage, oral fluid testing is probably the most effective method. And because that window of detection opens up immediately after drug use with oral fluid, you're going to catch some positives on that front end that you may miss with urine testing on its front end because its window takes a little bit longer to open up. It's going to last a little bit longer, though, than oral fluid. So it sort of balances out in terms of what you can expect to see from positivity rates. You see the middle column there is lab-based oral fluid testing with the Intercept device from OraSure compared to urine analysis in the laboratory as well. So the overall positivity rate, 4.1 to 4.4, very similar, but if you go down the chart to the THC line, that's the psychoactive ingredient in marijuana, you can see that it's actually a little bit higher with lab-based oral fluid testing compared to urine testing at 2.5 versus 2.3. That's fairly significant. And that's of course the drug that accounts for 85–90% of all the positives that you're going to typically see. Marijuana is the #1 drug of abuse, and it is detectable in oral fluid testing. I was talking to somebody earlier today who was under the impression that you could not detect marijuana in oral fluid samples, and of course that's not an accurate statement. There is a big difference between lab-based oral fluid testing and point of collection, or what we sometimes call POCT, or instant result oral fluid testing. So it is important to know what you're dealing with. The window of detection, the cutoff levels, etc., will be different with an instant result device versus a lab-based device. And so make sure you realize what you're dealing with. You can see here on this chart, it very clearly shows the positivity rate for THC at different cutoff levels. And so the vast majority, 80% of the positives, are going to be left of that vertical red dotted line there. And that's because at 50 nanograms or less, that's where the vast majority of the positives are going to be detected at. And you can see all the way over to the left of this bar graph, most of them are right there around 5%, 10%, 15, 20. So most of that 80% is way over to the left. If you're using a product with a cutoff level of, say, 35, 40, 50, where the red line is, and farther to the right, you're going to miss a lot of positives, because at that cutoff level, you're just not going to be able to detect the THC at the lower cutoff levels. And that's the difference. That's really the advantage to a lab-based oral fluid testing program, because the cutoff levels can go way down there to the 5 nanogram per milliliter level. And so that's something, as a buyer, you have to be very aware of and be able to look for when you're looking at a different, when you're comparing different testing methods, even different oral fluid testing methods. And just in conclusion to the whole discussion on oral fluid testing is the fact that it's just impossible to cheat with oral fluid testing. I mean, perhaps not impossible, that's probably not the right way to say it, but it's virtually impossible to really get away with cheating on an oral fluid test. All of the typical and very common methods of cheating with urine testing just don't exist when it comes to oral fluid testing. In fact, I was looking for information on the internet to try to find advice on how to pass a saliva drug test, as they put it on this website. Because if you go on the internet, you'll find hundreds upon hundreds of websites that sell products or offer advice on how to cheat. And on this one website, it said, try to avoid the test. I mean, the best way to get by an oral fluid test if you've got drugs in your system is don't let them take your saliva. Avoid submitting a sample, because as the second thing says, between a certain period of time, if you've got marijuana in your system and you let them have your saliva sample, you're going to test positive. So the best advice people have for how to get around, an oral fluid test, how to cheat, quote unquote, an oral fluid test is don't let them have your saliva. And I think that says it all, especially in an environment where you might have young people who go onto these websites and think that they're going to be tested with urine, and therefore they come with some type of device hidden on them, a substitute sample, etc., thinking that they can cheat on this test. And then when they find out they're actually being tested with oral fluid instead of urine, there's really nowhere to go. They're going to test positive if they give you a sample, if they have the marijuana in their system, if they've used it within the last, as it says here, in the last 24 hours, certainly in the last 24 hours. Okay? So, and this is just an example from a criminal justice setting, where they switched from a urine testing program to using the lab-based oral fluid intercept device. And you can see where the diluted specimens dropped from 5% to 0, of course, because you can't dilute an oral fluid sample. Just a little bit more backup on that to go with it. You'll get to see these slides later and go through them on your own. And that brings me to what I think is going to be my favorite part of the presentation, which is hearing from Kay McPherson, who actually has a lot of experience in working with schools and helping them see the need for student drug testing and putting programs in place that protect the confidentiality and the dignity of the students involved. So I'm going to turn the microphone over to Kay.
It is a very interesting topic. The drug testing process, I've had several clients call trying to, how do you get into the schools to do the process? And basically you have to just get in and visit with your athletic directors and the people that are with these students. The testing process is the oral is such a unique process, and the students don't have issues with their privacy, with the yuck factor. A good example, if you were doing 300 students' urine, you're up to 7 and 8 hours on site. you can do 300 students with the Intercept within a 4-hour period. And each one of these tests are directly observed by you, the person that's representing the school, and the students. It's a lab base, which makes the school and the parents feel more secure in that test. And then you get that report back. And you also try to help the school set up their program where the school's committed and it's communicated to the parents and everyone's on process with the collection process. I really enjoy the fact for the collection you can do so many more, and there's not the adulteration factors. The cutoff levels are where they should be in our society with the types of drugs that are being used. Confirmation test on how you teach the schools to deal with your medical review officers. You try to help them put together a follow-up plan. A lot of schools, we do the actual file maintenance. A lot of schools do not want these files on their sites, so you work with the schools in developing their program process and procedures. You introduce the schools to your medical review officer and what he stands for as far as making sure that your tests are true positives, as they call them. We're going to go to the next slide, and we're going to do a review on measuring the program's effectiveness. A program will not be effective for the school or the students unless the parents and the faculty and the students are on board. Confidentiality, that is a real issue, and there's a confidentiality statement on this next slide, that the district respects the privacy of its students and shall maintain the confidentiality regarding any alcohol and drug testing. All records and subsequent actions shall be kept in a file separate from the student's regular file. The district personnel other than the student and or his or her parent or guardian without written authorization from the student and or his parent or guardian. What this is basically saying, if you have a student that has a non-negative test, the MRO will only speak to that student. And each school only has one designated employer representative. That way the confidentiality is there. And the schools follow the state laws for your particular state. And some of the labor issues that come about are for the teachers and coaches. When you start to do programs with the schools and you go to one of their orientations, most of the time the third-party collector is the person that will explain the drug testing process to the parents, the faculty, and the students. Some of the issues that you're going to face and kind of be prepared is some parents don't mind their students being tested, but they all think it should be across the board, teachers and faculties. So be prepared to deal with those issues when you are trying to help a school get a program going. And school security issues, you have to address the privacy of the student, the privacy of their files. Like you keep a positive drug test on students for 5 years or until that student graduates. There's different issues that pertain to students versus in the workforce. Budget's another item that the schools are working with. All school testing is normally a government funded, and that is one of the reasons that you have such a fluctuation in whether we get to test or we don't get to test. And so you work with the schools and their budgets. Drug abuse among young people remains at an alarming and an unacceptable level. Drug testing has proven to be a powerful deterrent to drug use in a variety of settings, and your drug testing programs are legal and effective. Every school wants a program that's bulletproof. Oral fluid testing is easy to conduct, and it adds an element of dignity to the collection process. and your lab-based oral fluid testing is as accurate, scientifically sound, and legal in every state. When you're drug testing students, I'm just going to give you an example. A lot of people have requests that I share with them. How do you get into these schools? It's so hard to get into schools. Yesterday's a real good example. I've been working on this one particular school district for over 2 years. And now that they have been able to acquire some of the funds, some of the education that I've been providing them for their district, they are now ready to go ahead and start the testing process. And they were very pleased with the introduction of the Intercept product, because they were having second thoughts about doing the urine. But the Intercept is comparable to the urine, but just a lot better in the use of collection. And it's a very good product. I have used many products of the oral. I did a pilot last year of some of my schools with one particular product, and then the other with the Intercept. And I did have a lot better rates of positives with the Intercept that I didn't have with some of the other fluids. Plus, it's lab-based. You have the confirmation. You have the medical review report. Is there anything else that you need to add, Bill?
Well, you brought up a couple of interesting things, Kay, that I'd like to ask you. For example, and I know you've worked with a lot of different schools, and one of the things that you were helping me to understand was you refer to it as labor issues here, but I found it kind of surprising the level of support that you typically get from the coaches. Can you explain how that works and why they typically are so supportive of drug testing? Because I would think they'd be concerned about losing their star players.
The reason the coaches are so on board is for two reasons. First of all, when you are drug testing, it gives the students, it's a good deterrent when some of these students want to go out and party and have a good time on Friday night. It's a very good deterrent with them being able to say, hey, I want to play football next week. I'm not jeopardizing my sport because of a party this weekend. The coaches feel that that's a very good deterrent. They also like the Intercept because they can bring in the team. We sit the team down. We do the drug test. Everyone's had basically a direct observation. They like the way that the test is done, that it's only between the collector and the student does most of the work with the Intercept. They put it in their mouth, they put it in the vial, and they do the initialing. So there's really, it takes away a lot of the legality of the issues. The students aren't embarrassed. They have a more positive attitude towards taking drug tests, and they really don't feel that it's as evasive as what doing a urine test is.
Okay, so let's say, for example, in a particular community, they're putting the task force together, as we referred to it in our presentation today. Would coaches, for example, possibly a coach or coaches be on that task force? Would they have, so what would the rest of the adults that are looking at this be swayed by the level of support the coaches have for a program like this?
Yes, Bill, they do. Matter of fact, in all the schools that I've done over the years, the coaches and the coaches' staff are normally the ones that is handling the drug program and actually provide the monitors for the testing. You just have a more positive attitude with the coaches, and the coaches have the students on board, and the coaches are able to get the parents on board and help make that commitment work in their community.
So what do you, obviously you've been involved in several of these, or you've helped and you've come in, made presentations, I'm sure. What are some of the objections that the parents would have that you would, be able to help them feel good about this? I mean, are they concerned that drug testing is not accurate or that it's not legal? I mean, what are the kind of issues that you have to get around when dealing with these the adults that are involved in the process?
When you're dealing with the adults, legal and accurate are really, in their student privacy, are the real three things that come about. When you ask, is it legal, in certain states, for UIL or any school participation events, you do the drug testing. They can go with that, but then they worry about the integrity of the test. How do we know that this is going to be a true test? Well, in the past with certain products I've used, if we had a non-negative mark on the vial, I would have to do a urine test as my confirmation test, which actually you were doing two tests. But with the Intercept, you're actually getting the observance, you're sending the product to the lab, the sample to the lab, and you're actually getting a lab report. The faculty, the students, and the parents all like the fact that the test is sealed, sent off, and they actually get a true lab report. That takes away a lot of the questioning about the testing.
Oh, I bet it does. Now, in some communities, some parts of the country, and I don't know if this is necessarily the case in the region where your business is located, but do you hear lots of concerns about synthetic drugs? I mean, does that ever come up that young people are using synthetic marijuana or bath salts, things of that nature?
Yes, we hear that a lot, and we do try to test for the synthetics, but as you well know, it depends on the chemical analysis or the chemical compounds used, whether you're really going to get a true result on that or not. But yes, it is a major concern here where we're at.
Yeah, I did see a study not too long ago that showed that among young people, when they know that they're going to be tested for real marijuana, there's a trend to switch to synthetic marijuana until the threat or the risk of the drug test passes, and then they switch back. One of the other things that is probably important to point out that Kay was referring to is the fact that a regular traditional test for marijuana will not detect synthetic marijuana. You have to actually request that you test for the synthetic cannabinoids in addition to real THC. And as Kay mentioned, as states pass laws banning certain chemical compounds of synthetic cannabinoids, the makers just start to fool around with the chemical compounds and the mixtures, and they change it, tweak it just a little bit here, a little bit there, so that suddenly they're producing a product that is no longer on the list of banned substances. And so that makes it challenging for the laboratories to do that. But if anybody in the audience has that question, can you detect synthetic cannabinoids with oral fluid drug testing? The answer is yes. Not all laboratories offer that service, but can it be detected in oral fluid? Yes. Are there laboratories that provide or offer that service? Yes. But it is, as Kay mentioned, it's a different test altogether. Now, I wanted to ask a couple of other questions, Kay. I was taking notes during your presentation, and you made reference to law enforcement. Does law enforcement get involved in this? What happens, for example, when a student tests positive? What then is the typical consequence, or what happens at that point?
Well, if it's the probation department, they have their procedures because we do test for several probation departments. Law enforcement has started to use this particular test, even in the adult realm, because there again, it's an observed test, it's lab-based, and it's sent out. With the schools, you're taken out of your athletic program until you get to the next drug test and you have a negative drug test. Probation, it has different legality steps that it takes if you should have a positive test. But probation and the schools have really went to the Intercept because of the integrity of the test. You're able to observe, and you have the lab report to back up the test.
Okay. Now, when I do a presentation on lab-based oral fluid testing for a workplace audience, I'll talk about the fact that, one of the advantages is that the collection can be conducted on-site because it's so easy to do. You don't necessarily have to use an off-site collector. Although, I guess in some environments, like in schools, for example, would they like professionals like yourself to come in and administer the tests as well?
Yes, sir. Most of your schools, they want a third party because of the liability issues. And in my experience, when I go and do a presentation, they want us to do the actual collection, us to maintain the files, our company to maintain all records. The only thing that we notify them of is how the testing went, if there was a positive, and what to do in a follow-up program situation.
Okay. And then the actual, so now you're on campus, you're going to conduct these, the collection of the oral fluid samples. How long does each test take? I mean, you talked about being able to do 300 tests, et cetera, but how long is a student out of practice, out of football practice, or say out of class for a typical oral fluid test?
He is typically out of class from the time he gets there till he leaves, approximately 15 minutes.
Wow. So, I mean,
you have them come in, you have them put the device in their mouth, they are filling out the paperwork for their information, you open the vial, you have them put the stick in, break it off, put the lid on, the collector puts that seal on, she dates it, he initials it, check over the paperwork for final, because a lot of times students love to skip something. You check that paperwork, you seal it, and he's out.
Okay. So would these be students that have been randomly selected for a test?
Yes. Most of these students at the beginning of their school year, which begins in August, they do initial testing. We may do as high as 600 tests in a 3-day period.
Wow.
Then we do randoms, and that's normally 25% of the pool of students, and they come in, and most of the time we're in and out within a 3-hour period on their random program of 60 to 70 students. On a day where we have 300 to 400, we can be out by lunchtime with 2 collectors.
Okay. And I know the cost of a drug test varies by a lot of different factors, so I'm not asking you what the test costs, but how does the cost of oral fluid testing in a school environment compare to other testing methods? Is it comparable?
It's very operable and very competitive, yes, sir.
Okay.
And for
now, we've had a number of... go ahead. Okay, please.
For the pricing that you can give on the Intercept versus urine, the pricing there is very good, and they would much rather do the Intercept for the time management, and the privacy issues and cost.
Okay. And then somebody, one of our attendees today, wrote in with particular reference to the sports references that you've used, drug testing among football players and others. It wouldn't just be football, of course. That's the sort of the marquee sport in most high schools, I guess. But it would be students other than just athletes, right?
Yes, sir. The students that we do are all your football players, basketball, baseball, cheerleaders, ROTC, band, choir, anyone that will be in UIL and competition representing that school.
Okay. And then finally, if a school has a drug testing program, here, let me just throw out something that I read and that I've read a lot, and you see this a lot. I wonder if it's true, though, from your experience, which is that there have been studies that show that drug testing among young people in a school environment creates an opportunity for students to, say no to drugs because of the fear of being drug tested. Does that ever come up? I mean, where students actually are glad to be drug tested because it gives them an excuse to say no?
Yes, sir. Students, they like that, being able to say, I'm being drug tested, so I will not party with you this weekend. I've had a number of students tell me that, over even seniors that have graduated. If we hadn't had a drug test program, I think maybe I probably would have done drugs, but because I love football and we drug test, that was the best excuse I could use, and everybody knew it. It wasn't like I'm giving them an excuse and it's just one that I made up. When our school drug test, people knew that we really were being drug tested, and it's easier to say no.
Okay. And I've got another question here from the audience that I don't want to neglect, and it's kind of a little bit of a repeat, but the attendee writes in, I'm really curious as to the speed of testing. Did I understand that 2 collectors could do 70 student drug tests in a couple of hours?
Yes, sir.
Okay. So it really does move along that quickly.
Yes, sir, it really does, because you're not doing a one-on-one. A lot of times we might have 4 students on the front row, and each one has the swab in their mouth, filling out their paperwork. So once that swab is totally saturated and the time frame has gone by, we have them come up, we check their paperwork, we process the testing, and we're through. And you can just, I mean, it's just a very smooth process. It's one of the best processes I've ever done.
Okay. Another question from the audience. Do minors have to have parental sign-off or consent in order to be subject to drug testing?
Yes, sir. At the beginning of every school year, they have what they call the parent orientation package, and in that package, the parent signs stating that they know that their child will be taking an initial drug test and that they will be included in a random program. The student and the parent signs that release, and then that allows us to test that student all year long in the random program.
Okay. Another person writes in, what about confidentiality if several students are called out to participate in a drug test at the same time? And I guess to some extent, you know, you can't really hide the fact that if 4 students are called out of football practice at the same time, they probably all know that they're going to be drug tested. They might not necessarily know the result of the drug test, though, right?
Right. But when we normally test, we're testing 40 to 60 students. So after you test 8 or 10 students, everybody knows the collectors are there to drug test, and it's no big deal because the students actually have questioned us about how do you pick these names. Well, we use DrugPak, and we have those student names of every initial test that we did, and that's where we're getting these names from. And we'll actually show them the list. The school doesn't make this list. Our company makes this list, and that makes the student happy, and it makes the parent happy when they realize that the school has not been the one picking these random names or picking these students.
Now, in a typical workplace drug testing program with a medical review officer, he or she is going to contact a donor to find out if there's a legitimate explanation for a positive drug test result. Would an MRO in a school drug testing program contact a student, or would they contact a parent or guardian? What would their role be, the MRO's role be?
The medical review officer will contact the student. He contacts the person with the test, the chain of custody. And I tell the students, if they happen to say, well, I'm on medication, I will tell them to write that on the back of their copy of the chain of custody. A medical review is going to be calling you, and he's going to ask you for the prescription, the name of the drug, the pharmacy, and the expiration date. So be prepared. Due to HIPAA, we cannot ask you what you're taking.
Okay. And then we're about out of time, and I apologize to those who have submitted questions that we're not able to get to during the webinar, but we will follow up with you. One last question, though, Kay. Do you encourage schools to evaluate their programs, their drug testing programs, on, say, an annual basis? And if so, do you find changes in the positivity rate when it's known that drug testing is going to take place? Does that affect drug testing positivity rates over time?
Yes, sir, it does. And a good example of that, several years ago, I had a school that they realized they had a problem. And the first year we had 14 positives. And over the years that I've been testing, this last year they had 1. So they really saw the decline of positive drug tests by that school running a drug test program.
And, of course, it's important to point out. Yeah, and, of course, it's important to point out that a low positivity rate doesn't mean that the drug problem's gone away. It really means that drug testing is working. It's deterring drug abuse. Anyways, thank you, Kay, very much for your comments and your part of the presentation today. Thank you to all those who have come on today's webinar. I hope that you've enjoyed the presentation. We'll try to get to the rest of the questions in a post-webinar email to you, and I'll turn the microphone back over to Jessica.
Thank you, Bill and Jessica.
Thank you, Bill. Thank you, Kay. And on behalf of OraSure Technologies, we hope you have found today's presentation informative and helpful. This presentation was recorded, and you will receive instructions informing you how to access the recording. Thank you for your attendance today. This concludes today's webinar.
Thank you. Bye-bye.